Hi, my name is Kevin Ryan. I'm the Associate Dean of Professional Programs here at the Fay W. Boozman College of Public Health at the University of Arkansas for Medical Sciences. I also have the honor to serve as the co-director of the DRPH program, our doctorate in public health, and am associate professor in the Department of Health Policy and Management here at the college. I have been affiliated with the college since its inception, now about 13 years ago. By training, I am an attorney. My terminal degree is a JD, or Juris Doctorate. Many of my colleagues here have terminal degrees that are PhDs or MDs. A number of our faculty and staff have masters in public health. There are relatively few Juris Doctorates. However, I've often submitted to my friends and colleagues and students that public health law, which is my area of specialty, really is the very core of public health. When we consider that public health is about protecting and promoting the health of populations, the health of communities, the health of families, and that ultimately it is the government that is the guarantor of public health, you cannot have public health without public health law. It is indeed the very core of public health. Well, what is public health law? Public health law really is about the power of the government to protect and promote the public's health, the duty and responsibility of the government to do that, and finally, what mechanisms and measures do we as a society have in place to restrain the government? Because you see, public health law, and indeed public health, really is about a balance between the public's desire and indeed right to be free from harm, and individuals' rights and freedoms as against government intervention. Those are like two ends of a teeter-totter. They're never in perfect balance or synchronization. Indeed, they're always changing based on the issue, based on the need at the time, based on the time. What was the appropriate balance 100 years ago between government power and duty and individual rights is not at all the same as it is today. It's constantly changing. The fact that it is constantly changing, ever dynamic, is what makes this an incredibly fascinating area for me. I love being an attorney. I love being a public health lawyer. Like all of my faculty colleagues, I have a number of areas of interest. Mine over the years have focused not so much on research, because remember, public health is at its most essential evidence-based, a scientific discipline. And while in my work I incorporate data, study results, etc., I'm more involved in using that data to develop and inform programs and policies to improve the public's health. In particular, I have for a number of years been involved with and interested in how do we protect and promote the health of underserved populations, traditionally underserved groups such as women, children, people of color. They have disproportionately suffered many public health ills, from chronic disease, access to health care, health insurance coverage, etc., as opposed to others in our population. So how do we go about making sure that all of our public, everyone in society, has the best possible access to health and health care, have the best possible means to protect and promote their own health and well-being? And that's what I, as a public health lawyer, have been interested in. An additional administrative area of responsibility I have here at the College of Public Health is oversight of our concurrent degree programs. The Fay W. Boozman College of Public Health has affiliational agreements with several other programs, professional degree programs and schools here in Central Arkansas. We have a concurrent degree. Sometimes you may hear these referred to as joint degrees with our College of Medicine, the William H. Bowen School of Law here in Little Rock, the Clinton School of Public Service here in Little Rock, as well as the College of Pharmacy and the UALR Masters of Arts in Communication Sciences. So students enrolling in our concurrent degree program can receive both their home degree, if you will, an MD, a JD, etc., as well as a Master's in Public Health. Importantly, for these folks who decide to pursue this, we have, in reaching these affiliational agreements, have determined certain classes that can cross-count. Classes in the College of Medicine, for example, that can count towards the MPH degree. Classes pursued through the MPH degree program that can count towards the College of Medicine degrees. So a student can graduate at the end of 3, 4, 5 years, whatever the length of their home program is, with both their home degree and an MPH, which makes, in my estimation, a very powerful combination. It adds to and amplifies whatever degree they have and allows students to pursue some very unique and important career areas, oftentimes for which there's a very great need and a potential for employment. Because at the end of the day, we want to graduate students who can both serve society, have great careers, and the ability to pursue those careers. I appreciate this opportunity to speak with you today. If you would like any more information about my area, public health law, or any public health degree program here at the UAMS Fay W. Boozman College of Public Health, I would encourage you to access our website. That is www.publichealth.uams.edu.